Fainting spells can signal potentially dangerous heart disease. Dr. David Mischkel of Boca Raton Regional Hospital joins us this afternoon to talk more about this and to answer a few questions. Thank you so much for joining us today. What happens to us that we faint?
Basically is caused by a lack of blood or nutrients to the brain, and the brain can't function normally, and we lose consciousness.
And how does that connect to heart disease?
Well, there can be a lot of different causes, and there could be a reduction in the heart rate or a reduction in blood pressure, and that could cause lack of blood flow to the brain.
And then it connects to vasovagal syncope.
Yes, vasovagal syncope.
Vasovagal. I want to do that. I keep wanting to say that the incorrect way, but a lot of people don't know what this is. Go ahead and explain what it is, a couple of big words, and connect it to heart disease and fainting.
Well, to simplify things, I don't know if you've ever seen the YouTube video of brides and grooms fainting at the altar, but that's what happens. Sometimes we may be standing for too long, and the blood can pool in our legs, and our hearts are underfilled. So the brain isn't getting the blood that it needs, and there may be a drop in blood pressure or heart rate, and we lose consciousness.
Does that have to do with nerves? Are there other things that can cause that to happen, or is it just something that anybody who is exposed to standing for long periods of time could experience?
Well, you know, there are other stimuli. You may have had this happen to you if you've given blood and you faint at the sight of blood. So emotional upset along with posture could do it.
Okay, now sometimes though this can be connected to heart problems, and what is that?
Well, there could be problems with the electrical wiring system. That could be fixed with a pacemaker, or there could be problems with the heart valves not permitting blood to get to the brain. That could be fixed surgically as well.
Is fainting more often than not connected to heart disease?
You know, the commonest cause of fainting is this vasovagal syncope, and that usually is a benign condition. But you have to watch out for other dangerous conditions. For example, blood clots going to the lungs can cause you to faint. If you lost a dangerous amount of blood, or if your blood sugar was very low, those are other common causes of fainting.
How is it diagnosed?
Well, you need to see a physician. Fainting, although it may be of a benign cause, can result in harm to you or other people, and it can be worked up and diagnosed with appropriate testing along with history and physical examination.
Now, why do some people faint after strenuous exercise?
Well, that can be a sign of something dangerous. We've all heard of famous athletes dying suddenly on the football field or the basketball court. So if you were to faint in the middle of hard exercise, that could be a fatal arrhythmia, and that needs immediate attention. If you just happen to exercise and then stop exercising and are standing still, that could be the blood pooling in the legs, and that could be benign.
Now, sometimes a person blacks out or may feel lightheaded or dizzy after standing up, and it can especially be in elderly patients, can it?
Yes.
Now, how does that connect?
You know, I think through our lives we all feel episodes where we're lightheaded if we suddenly stand up or we bend over our entire shoes. And that's normal. It's that issue of blood pooling. And we have these reflexes to right that and to increase our heart rate and our blood pressure to get blood to the brain. But as we age, those reflexes can dull a little bit, or they may be interfered with by medications or other conditions like Parkinson's or diabetes.
Thank you, Dr. Mischkel, for your time today. We appreciate it. Boca Raton Regional Hospital sponsors our doctor and also underwrites our Ask the Doctor segment. We're back with more in just a moment.